Yeah, Assalamualaikum and very good morning to everyone. I am Shahril Effendi from OEM Digital Library. Thank you for joining today's session on online training on clinical key nursing database. Okay, this session is being recorded and will be placed in OEM platform by tomorrow. Okay, with us today is Miss Carol Chia from ED Connect, distributor for today's database that we want to learn, clinical key nursing database. Okay, before we proceed, I would like to share you my screen on how to access this database through OUM platform. Okay, allow me to share my screen right now. Okay, in order to use the database, you have to enter my OUM. Okay, use your username and password. I believe all of you have the username and password for my OUM. Okay, click login. And then for student, we will see like this. Okay, and then go to Digital Library 2.0. And from this is the library portal. We go to database menu here, and then we click scroll down menu, and then choose clinical key. Okay, and then click search. Now we are in this clinical key database. Okay, we are now recognized as authorized user for this clinical key for nursing database. Okay, from here, I believe Ms. Carol will show you on how to access, how to retrieve various information from this database. Okay, with us today is also Missy. Okay.
Hi, everyone. Thank you. Thank you, Miss Carol. Thank you, J. Sharil. Please proceed.
Thank you. Okay, thank you, Missy. Okay, Miss Carol, we can proceed now.
Okay,
The
can
session is
I'll
to you.
share my screen, yeah?
Okay, I stop presenting now.
Can.
Okay.
Um, if you don't see my screen, just let me know, yeah?
Yeah.
Okay. Hi, very good
Okay, we can
morning.
see.
Okay, very good morning to all of you. First of all, I would like to, wish our Muslim friends Selamat Berpuasa. Thank you, Encik Syaril, for organizing this training today. My name is Carol. I'm representing Elsevier. My job is to help Elsevier and medical publishers in providing educational and research reference solutions to the university, in helping to enhance medical and nursing education, support research and clinical decision making. So today I'm representing Elsevier to share with you, to give you training on clinical key for nursing, learning and research reference solutions for nurses to, efficiently carry out treatment plans and doing research. So, okay, I'm just going to share my agenda. So, we are doing this for your information. This platform is currently subscribed by OUM. I'm doing this training from time to time to, create awareness so that you know that there's such a powerful platform available. And you can utilize it for your studies and for your research and etc. So the agenda for today is I'm going to go through very briefly about what the platform is about, ClinicalKey for Nursing. And then for the benefit of first-time user or you are something very new to this platform, I'm going to guide you in how you can do a registration. And I'm going to guide you on how you can activate remote access and what are the benefits you can activate remote access and download to mobile app. Later on, I'm going to, spend more of the time in, doing online demonstration on ClinicalKey for Nursing. And later on, if we have some time, I'm going to introduce on Osmosis, another new platform from Elsevier, which is currently we are providing a free trial access for you until 22nd of March. So if you have questions, feel free to, put in your questions in the chat box so that I can, attend to your questions later. So let's take a quick look at what ClinicalKey for Nursing is about. So whenever you need to prepare to present case, interpret clinical results, preparing for nursing care plans, research on the topics, you need a reliable and evidence-based information to support your research and assignments or your presentation. And you don't have to search so many places for answer because it will take up your valuable time. So the platform of ClinicalKey for Nursing can help you with that to increase your efficiency. It is an online nursing resources that can use at the point of care as well as the point of reference. And also for those who want to do in-depth reading for research. So it provides access to the vast library of nursing texts and reference books, journals, Mosby evidence-based nursing monograph, practice guidelines, drug information, and many more. So in this slides, I'm going to share with you what are the content coverage. So ClinicalKey for Nursing, it covers over 60 journals, full-text journals, 85 full-text books, practice guidelines, Mosby evidence-based nursing monographs, which are latest evidence-based about common clinical problems with level evidence, nursing recommendation, and other information that help to prepare nursing care plan. We also have drug monographs, patient education, handout, videos, and images. So this offering covers more than 30 specialties, including critical care, emergency medicine, internal medicine, pediatrics, and more. Some of the, example of the popular titles I put out from this platform, including medical surgical nursing, Sonder nursing drug handbook, American Journal of Infection Control, Heart and Lung, Journal of Pediatrics, Healthcare, Burns Pediatric Primary Care, and many more. So before I go to the demonstration, there's some important notes I would like to highlight to you. I understand that Ajay Shariel has shared with you how you can access ClinicalKey from library portal. Okay, so whenever you need to access quickly ClinicalKey for Nursing via library portal, wherever you are, you can just go through the method that he has shared and you'll be able to access the full text. But there's a feature which you can download the mobile app. Okay, so in order for you to download the mobile app, how is it different is that if you want to, sometimes when you're in the hospital and you don't have the desktop and laptop with you, but you still need you want to find answers to the questions, you just take out your mobile app and then key in your search term. Then you'll be able to find answer. So with that mobile app, you need to create an account in ClinicalKey. So I'm going to share with you what are the benefits you create your account in ClinicalKey is you can activate remote access, which allows you to download mobile app. Okay. Second thing is whenever you see there's any chapters or articles or content you would like to share with your friends or your classmates or your assignments group, you can email. You can, email, whoever will click on the link will be directed to the certain articles or chapters or content. And whenever you see any images, graph, charts, which you want to add into your presentation slides, you can do so by exporting all the images that you have saved to presentation PowerPoint. And this can be done only if you log in with your personal account. So if you are first time accessing to this platform, I would suggest you to register an account by registering an account using your OUM email address. So next, how you register and activate remote access. First, you need to go to www.clinicalkey.com. Remember to add /nursing. The common access error I received is a lot of users didn't add in the nursing at the end of clinicalkey.com. Because if you log into clinicalkey.com, it's another platform which is meant for physician, which is not currently subscribed by OUM. So remember, go to the link /nursing, clinicalkey.com/nursing. And if you are first-time user, first time seeing this platform, first time accessing this platform, please register. Select register button on the top right. And once you select register, you come to this page where you are asked to put in your details. Make sure you register with your OUM email address. Please don't use your personal email, whether it's Yahoo, Gmail, Hotmail, because the system won't be able to verify that you are a subscribed user from OUM. Okay, once you have done that, you have keyed in all your details and you click submit. You shall be brought back to the home page of ClinicalKey for Nursing, where you see your name on the top right. So click on your name. You shall see this drop-down menu on the screen. Please select remote access. I'm gonna guide you on activate remote access so that you can download mobile app. Select activate remote access. And remember this, you only need to do this once. Once you select activate remote access, you'll be brought to this page where you need to key in your registered email address again. Put in your OUM email address and select continue. And a remote access activation email will be sent to your OUM mailbox. Make sure you check your OUM email. Once you check your OUM email, please look for email with this message that asks you to click on the link, select the link to activate remote access. Make sure you click on this link. And once you've done that, congratulations, you have successfully registered an account and activate remote access, and you'll be able to download mobile app. And subsequently, you'll be able to access the full content in ClinicalKey for Nursing. Don't worry, this guide, so registration and apply activating remote access guide is also available in your library portal. So just click on the link and and I also, put in a QR code here where we stated the guides, how you register and apply remote access. If you missed my a few slides earlier. So this is the QR code, the guides to download the registration and also mobile app installation guide. So once you have successfully activated remote access, then you can go to App Store or Play Store, depending on your mobile version, whether it's Android or iPhone. Just go to App Store or Play Store, search for ClinicalKey, then install it, and you'll be asked whether you want to access to ClinicalKey or ClinicalKey for Nursing. Please select ClinicalKey for Nursing. And then they will ask you to put in username and password. So after you install, this is what you're going to see. They will ask you to select whether it's ClinicalKey for Nursing or ClinicalKey. Make sure you select ClinicalKey for Nursing. And you'll be asked to put in your username and password. So all this guide is available to download in your library portal. Okay. So I'm just going to switch the screen to the online demo. Let me switch to my window. Let me log out first. Okay, for returning user, simply select login. The common questions I got from user is that they forgot their password. Don't worry, you can just simply select forgotten username or password and to reset. After you reset your password, right, remember do another steps, which is applying remote access. Okay, so this will allow you to download mobile app. So if you want to register, just select register button on the top right. So I'm gonna, continue to log in. Okay, this is what you won't see. Okay, this is the home page of ClinicalKey for nursing. Make sure you are logging into the right web. Make sure there's a nursing at the end of the URL. The common access problem from some of the user is that they straight away go to clinicalkey.com, which is different platform. Yeah, make sure you have a /nursing here at the back. Okay, you can start performing a search by putting a condition, treatment, drug's name, and then you can filter by the content types. Whether you want to look at books, journals, guidelines, videos, and others. And if you have time, you are curious about what are the contents available in the platform. Like, for example, you want to see what are the guidelines available in this platform. I just want to let you know that ClinicalKey for Nursing covers international guidelines, but not all. Some handful of Asia and Malaysia guidelines are available here. Okay, so let's go back to the home page. And if you scroll down further, you'll be able to see books and journals. So in case you want to know what are the books, titles, and journal title, you can access full text. You can always click on here and, browse the books before you consulting the librarian. You can either search on the title, or you can filter by the specialties here. Okay, let's go back to the home page. I'm gonna, start performing a search. You can, search any search term that you like, but I'm just gonna use one search term as an example. Like, for example, I want to, search for pressure injury. Before you finish typing, the system will anticipate by what you are searching by suggesting a drop-down menu here. But for today's training, I'm just gonna, give you a wider search result. So I'm okay with pressure injury, and I press enter. Whenever you're searching for a condition or a disease, right, you shall see a disease overview on the right. This will be useful for someone who wants to know at a quick glance about a complex case, a complex disease, or complex condition. So this is something will be helpful. At a quick glance, the user will be able to know, oh, okay, what this disease is about. If you have time, then only you can click on each of this to get into the specific sessions of this condition. So we also have a point of care information on, which is called clinical overview, which give you an overview about this disease condition, including differential diagnosis, treatment, medication, and so on. So before I come to this, I just want to share with you, the center is the results panel, which gives you 4,000 over results. It's impossible for us to read all this. So I'm going to guide you in filtering your results by using the filter panel on the left. You can, filter further by journals, books, more information here, clinical overviews, procedures, drug monographs, practice guidelines, nursing skills, and more. If you are specialized into certain specialties, you can, expand the list and select into certain specialties to narrow down your search results. If you scroll down to the bottom, you'll be able to, filter further by date of publications from last 6 months to last 5 years. In ClinicalKey for Nursing, our objective is to provide you the latest information possible, so you can get the results up to last 5 years. But for today's training, I'm just going to focus on the source type here. And whenever you search for a condition or disease, clinical overview is always displayed at the top to give you evidence-based overview about this disease. If I select on pressure injury in clinical overview, I'll be able to see the overview. Oops, sorry. Okay. Some overview about pressure injury. And this is, designed for the point of care. And if there's any urgent action, it will appear in the orange box here. And I mentioned about evidence-based, kan? So you will see that end of the sentence, it ends with a number with hyperlink. So this provides you to the evidence of the literature. And this is linked to the guideline, international guidelines. If you have time, you want to see the guidelines, then you can select cross-ref and you'll be brought to the guideline page. There's some error in the guideline page. So I'll just go back here, coming back to ClinicalKey and look for other points. You see, it also includes the key points, and you can see all these are, summarized for you. At a quick glance, everything about this disease. And let's look at, one of the link here. It brings me to PubMed. It says about review of current management of pressure ulcer. So whether or not you'll be able to access full text is depending on the publisher. Let's see if this is open access journal, open access article. One is in wound care. Yeah, I think it is. It's a full text. Okay. So this is how you link to the evidence. And you can also download the PDF here on the top right. Okay. So this is how you link to the evidence of the articles from ClinicalKey. Let's come back to ClinicalKey. Other than that, you can also view more information about terminology, clinical clarification. So this is something will be useful if you are, doing more readings. It also gives you classification about, based on this guidelines. There's this stage 1, stage 2, stage 3, stage 4, and diagnosis, which also includes the images. So whenever you see there's an image, you click to enlarge, you shall see add to presentation. I will go into add to presentation later to guide you on how you can add this image and convert to presentation PowerPoint. I'll come to that later. So you can also email this to your friend and also print this out. And also you can save it to the folder and you can retrieve later. I'll just close it. And you can also see causes and risk factor, diagnostic procedure. And if you want to see what are the medication, you can come to the treatment, scroll down until you see drug therapy. So these are, antiseptics information available. So what I'm gonna do is I'm gonna, copy down this drug, this medication, so that I can research on it later. Okay, so that's how you can have a quick glance about evidence-based content of pressure ulcer. But of course, we always encourage students to read further from the book chapters and articles. You can also do so in ClinicalKey. So what you do is you go back to the search results. You go to the top of the page and click back button. Oh, sorry. Just go to the home page and put pressure injury again. And, I've done the clinical overview. I want to read further by viewing some of the book chapter. You know that when we refer to chapters, book chapters, right? We refer only certain chapters from various of books title. So when we purchase a book, we don't read the entire book. We refer different chapters from various of book titles. So in ClinicalKey for Nursing, it helps you with that. It pulled out chapters that related to your search term from various of titles. Like for example, you see that the result has been narrowed, pulling different chapters from different title. This is taken from, clinical presentation chapter, and this is taken from Ferry's Clinical Advisor 2024. And you can scroll down to look for other results from other book title. So this is taken from acute and chronic wounds. And you can always scroll down to look for other chapters from other books title. Let's say I would like to look at the first results. I'll be directed to specifically to clinical presentation. And, based on this guideline, it also provides me with the stages of pressure injury. And feel free to access to other sections here by selecting the, the table of content here. You may be wondering, what are the, the cover of the book. You want to see what's the cover of the book. You can always select top of the book chapter to view the cover of the book and also the edition. So this is 2024 edition, which is the latest edition. The advantage of you accessing to the books here in ClinicalKey is that you can be assured that we are referring to the latest edition. Because whenever new edition of books is being published, it will be updated here first in e-copy and replacing the old edition. So if you scroll down to any sections of the book, right, and if you think this is something will be helpful that you want to share with your friends, you can always, or share to your groups, you can always copy the URL link here on the top and share in WhatsApp or in your coursework or teaching slides. Whatever you click on this link will be directed to these sessions. So this will prevent, your group members referring to different content from various of resources. So if you want to save this content into the folder of ClinicalKey for Nursing, you can always select the star here and save it. Depends on you whether you want to create a tag or not. You create a tag so that you can, save all the content under the same tag. Okay, I'm okay without the tag. I'll just click done. In order to retrieve the content you have saved, just simply select the 3 dashes on the top right. Go to the save content. Whatever you have saved are all stored here. This is how you retrieve the content you have saved. Let's go back to the search results. Just now, I was sharing you about the books chapter. Same to the books chapter, you can also, let's say I'm doing research. I want to find out latest findings about a pressure injury, for example. I want to look at what are the journals articles on this search term. I can filter, select the journals articles. By default, it will return results from full text from publication of Elsevier only. Okay, based on the feedback from most users from ClinicalKey, the results from full text only are sufficient for them to read, unless you are searching on a very newly new topics, newly discovered disease or rare cases that is so rare that you don't see a lot of studies available in the available. So you can select full text and Medline, meaning the system will be able to pull out search result for Medline as well. Okay, bear in mind, results from Medline only giving you abstracts only. You won't be able to access full text. So this will help you to get all the result in one page without the need of you searching in Medline again. So otherwise, by default, full text is sufficient. If I select on journals articles from full text of publication for Elsevier, I'll still able to get 3,000 over results. And this is the title of the journal, and this title of the article, and this is the title of the journal. This is taken from Intensive and Critical Care Nursing. And scroll down, I'll be able to see different results of different journals. This is taken from International Emergency Nursing and others. Let's pick the first one. And whenever you see there's a PDF here, means that you're allowed to download PDF. This will help you to, you download the PDF and save on your desktop to view it offline. And, you will be able to see the cover of the journals on the right and the volume and issue. Okay, again, if you want to share with your students or to your group members, just simply copy the link here and share with them. Let's go back to the search results. I clear for the filter so that I can share with you other content. I'm gonna, due to time constraints, I will not go into every details of the content. I'm just gonna skip the guidelines and clinical trials because these are pretty straightforward. If you're involved in clinical trials, you want to view more, you can just select on clinical trials, and you want to look at what are the guidelines. There are 45 guidelines regarding a pressure injury. You can always select here to view it. One very important content I would like to share with you is the Mosby evidence-based nursing monograph. This is a piece of information provide latest evidence about the clinical problems, including summaries of key studies, tagged by level evidence, nursing recommendation, practice guideline, and all more information about that are suitable to prepare for your nursing care plan. Let's select the first one. Every topic in Mosby evidence-based nursing monographs includes information like clinical questions, pathophysiology, current practice. So it includes identifying the risks, relief strategies, also stages, and also clinical practice guidelines and also the synopsis of current literature, and with the level evidence. So this laboratory test as supplement to the Braden scale. So this will be very useful for your research, and also the nursing recommendation that includes assessment, data analysis, planning and implementation, discharge planning. So I think these are very useful if you are, want to prepare for a nursing care plan and do your research. And of course, all this information are backed by the articles or guidelines, which are all stated here where you can look at the references. So make sure you refer to the Mosby evidence-based nursing monograph. If I select back to the results, I can also view more information like patient education. So this is very useful if you are advising the patient, and you can also print this out and share in the clinics or share with the patients for patient educations. So every topics in patient education, it includes in layman language explanation about the disease or conditions, the causes, what increases the risk, signs and symptoms, how it's being diagnosed, the treatment, home care instruction if there's any, and what the patient should know to contact the healthcare provider is if the patient discover all this problem. And if you go to the top of the page, you'll be able to print this out. And bear in mind, the printing of patient education require you to log in with your username password. Like you can also put in some instructions like follow up after 1 week, and put in your contact details. And then you can, create printable PDF. So the patient educations will be, converted to PDF. So yeah, this is something that, you know, will be helpful if you want to create a patient education. So let's go back to the search results. Apart from that, there are also content about nursing skills. So there are also guidelines. This is taken from the guidelines on the staging guidelines, and Bradder scale. All these are downloadable in PDF. Let's look at the videos. If I want to see some of the videos, there are 9 videos available. So feel free to, you know, access all those videos that are available. I'll just select one of the example.
There are many different types of splints, which are used to stabilize fractures and other traumatic injuries. In this video, we will demonstrate the general technique used in the application of both plaster and prefabricated fiberglass splints. Specific techniques for various anatomical.
Due to time constraint, I'm just gonna show you a sneak preview, but I do understand that some of the because this video and this platform is developed in the US, you may see some of the techniques and the devices or the equipment used are different from Malaysia. So that's the reason I will feel that these are the video are for reference only. So it's also very important to have lecturers, tutor to be there to advise you what will be the proper way for Malaysian, you know, following the UK version. So again, this video cannot be downloaded, but there's a unique URL here that you can share with your friends and also students. You can also email to create the link. So this link, so whoever who will click on this link will be directed to this video. Okay. So these are the, you know, the information you can find here. Make sure you know, refer to the source type here on the left to see what are the videos or contents available. I will also want to share with you on a very good features, which is Presentation Maker. I received very good feedback from the most user of ClinicalKey for nursing, especially when they need to prepare for teaching slides or presentation, symposium talk, where they need to include some interesting and trusted images. I will always suggest you to come and look for the images here in ClinicalKey for nursing instead of going to Google Images. So let's say I'm going to use the same, you know, pressure injury search term, and I filter by the images. The system pulled out images, graph and charts taken from books and journals and display here for you. So there are 300 over images found. And let's say if I'm interested on the first one. So this is taken from the journal Intensive and Critical Care Nursing. So, and I find that this image is useful in my presentation. So I want to add into my presentation slides. So scroll down to the bottom of the image. Every image that you found, you shall see this 4 icon. Select the second one, which is Add to Presentation. If you're first time using this feature, you are required to create folder. You can create as many folder as you like, and you can name the folder differently. I have previously created a folder. I have created 4 folders. I'm gonna continue to put into pressure ulcer folder, and I click Add. So this image is added to pressure ulcer folder. Let's close this window. Let's add another image. Probably I'll add this image. This is taken from Journal of Vascular Nursing. And click the second icon again, Add to Presentation. select the same folder that I have created. And this time I want to view all the images that I've saved in this folder. So I select Add and View Presentation. I'll be brought to Presentation Maker page where I can see all the folders I created are here. Point to Pressure Ulcer. I'll be able to see all the images that I've saved are all stored here. If you do not want any image, you just select the image and click the dustbin to delete it. Okay, so I'm good with 4 images here. So now I want to export, convert them to presentation PowerPoint. You can save as many images as you like, but bear in mind, the more images you save, it takes longer time to convert to presentation PowerPoint because of the size. I'm good with all those 4 images. I'll click export. I probably have to, switch the screen to share with you the PowerPoint. Let me share the entire screen. So this is the PowerPoint. PowerPoint has been converted, displaying one image on the single slide, and also the reference of the image, and also the description of the image. If you want to edit it, feel free to edit. If you think image too small, you can always adjust it to be larger. And you can be assured the resolution is good and no watermark. So this is I hope this will help you to, make your presentation better, help you, in preparing for your teaching slide, your presentation, and symposium talk. Okay, let's come back to ClinicalKey. I have guided you on how you can make full use, how you can find information faster with using the filter in ClinicalKey for nursing. So whatever you search, I'm using browser here, laptop browser. So whatever you search from the browser is gonna be the same as you search from the mobile app, except that Presentation Maker is not available in mobile app because mobile app, it only allows you to view only, navigate and view only. You won't be able to create presentation from there because of the screen size. While you are accessing to, to ClinicalKey for nursing, along the way, you may be wondering what are the books and journals. Again, I'm going to highlight again. Before you consult the librarian, you can always come and browse yourself. Select the books. You'll be able to see a list of the book displayed in alphabetically order that allows you to view full text. It also gives you a feature books here, just suggesting some of the popular books here that to inform you that you can view full text. One of the popular books is Operating Room Techniques. This, you can also view full text. Select this title, then you'll be able to see different chapters, different sessions, and select any of these sessions or chapter, then you'll be directed to this chapter. Okay, so bear in mind there's no PDF of books, yeah, only PDF available in journals articles. And if you select journals, you'll be able to see a list of the journal listed in alphabetically order. Okay, some of the featured journals is also displayed on the right. And one more tools available in ClinicalKey for nursing is the clinical calculators. I'm not sure how much it will be helpful for you, but these are the drug calculators, condition calculators. One of the, I'll just pick some of the example like cardiology, cardiovascular risk assessment for men. Like for example, this is calculators that help to calculate cardiovascular risk assessment in type 1 diabetes. So by putting in all this input from the patients, it allows you to, calculate, it helps you calculate the risk of this man to have cardiovascular problem. And the calculators is being categorized into different category. For drug calculators, you can, access to some of the, drugs calculators, like, calculating the therapeutic drug monitoring. We have also pharmacies who are using these functions to help them with their, their job. And also nephrology. One of the popular calculators is creatinine clearance. Okay. I think that's all about ClinicalKey for nursing. I'm gonna pause a while to see if you have a question. So if you have not questions, I will want to, share a bit about free trial access to Osmosis. Hang on, let me. Okay, I want to share a bit about getting your feedback about ClinicalKey for nursing, because we are preparing for renewal every year. We want to know whether you think ClinicalKey for nursing is something useful, and if you support OUM continuing the subscription to ClinicalKey for nursing, we appreciate your input in this feedback, so that librarian and management and myself, we can compile your feedback and renew the subscription. So you can scan the QR code here. Probably I'll share in the chat. So this is the survey for ClinicalKey for nursing. Okay, so we appreciate your feedback. If you're to know what do you think of this platform, if you think it's useful, please feel free to put your feedback. Okay, you can save this link and you can save this link and you can provide your feedback later. I got a questions about, will this be uploaded? Meaning the survey link will be shared with all of you. I think I can get Encik Syara to share the survey link to all of you. Okay. Before you go, I just want to share something about Osmosis nursing. My job is to ensure that you are keeping up to date with what are the teaching and learning platform available, especially from Elsevier. So this Osmosis is quite popular among students and lecturers, but for those of you who are not aware of what Osmosis is a library, learning platforms that provide nursing videos, very video rich content, which helps you to understand, the student understand better with thousands of pathology, physiology, anatomy, and clinical practice video, together with NACLEX style questions, math tables, and all of this at your fingertip. I'm going to show you a short video.
Did you know medical error kills millions of people every year worldwide? As medicine evolves, we need a different kind of nurse to help prevent these errors and save more lives. Today's nurses now need greater critical thinking skills, higher emotional intelligence, resilient soft skills, and a deeper understanding of their patients. Osmosis is here to help change nursing education and help you gain these crucial skills. Not only will you learn what you need to pass your exams, these powerful new tools give you the knowledge you'll need in the real world. With Osmosis, you'll become a nurse who has a deep understanding of the nursing process. You'll master complex subjects like pharmacology and pathophysiology. You'll gain a deeper understanding of your clients so you can make confident decisions and provide better care, and feel more secure in your abilities. These big changes are underway. Secure your
Sorry.
Spot at the forefront of nursing. Be one of the first to get all the great new content and features we're rolling out. Become an Osmosis Prime member today.
Okay. I just want to, just let you know that this is currently on
Did
trial.
you know?
This is currently so what Osmosis is about is it support independent and distant learning with nursing learning videos. It helps to make teaching and learning easy. So how is it different from ClinicalKey for nursing is that this platform is a video rich. That means it's helped to explain the topics with videos and then provide you with questions bank. So students can, make full use of the video to understand the concept. Later, they can attend to the questions to know how well they can learn from the topic. So from the questions, they will be able to know whether they understand the concept or the topics better. So it helps you to, with all these questions bank, right? It make it easy to understand and retain. So the content coverage covers the core nursing subjects, including fundamental of nursing, anatomy and physiology, health assessment, medical surgical nursing, pharmacology, pathophysiology, and more. And it also includes questions bank, over 3,000 over questions with learning objectives and detailed rationales that promotes learning over memorization. If you are, preparing for exam, I think this is something very useful because you can keep accessing to the questions until you memorize it and retain the knowledge. I want to share with you the free trial access. So what you need to do is just copy select the link. Hang on, let me copy. This trial is until 22nd only, yeah. For your information, please click on the link to register an account and access full content until 22nd of March. Okay, we have student asking about how can they get the video recording. This will be uploaded to the library portal. Make sure you refer to library portal probably on Monday, because it takes some time to upload to the library portal. Right, Anja Sharia?
Yes, yes. At the end of the session, I will show you them on how to access the recording. Okay.
Okay. I want to switch to the screen that show you about how you navigating Osmosis. So once you have selected the link here, which I share in the text box, and you register an account, then you'll be able to, log. This is the page that you're gonna see. You'll be able to browse all the topics in Osmosis Nursing, fundamental, practice concepts, nursing series, body system, and these are the essential science covering, anatomy, physiology, pathology, microbiology. Okay. So I'm just gonna, select one of the topics to show you example. And let's say I would like to know about, medical surgical nursing. If I scroll down, I look for multi-system, and I scroll down again, I look for let's say on maybe on this topic, post-operative care nursing. So in every topics, right, you'll be able to see a video, explanation video, very animation video. Sorry, because I'm sharing entire screen, you won't be able to hear the voice. By right, you should be able to hear the voice. So this will provide you with the explanation in animation format. So this will help you to engage, with the video. So you see, okay, then you learn better. And of course, you can also jump to the chapters like management and care. So instead of viewing the entire video, you'll be able to see the subsections. If you scroll down, you'll be able to see the, descriptions of this topic, and you'll be able to add in notes if you want to put in notes, and also you'll be able to see the transcript. Then after viewing this video, you can come to the assessment. You can come to the assessment, select on start or resume, because I have viewed the questions. Start, then I'll be able to access all these questions. Okay, select all that apply. I'll just simply select any of this, and they will ask you to rate your confidence, whether it's low, medium, high. If I'm low confidence, I'm not confident, I'll just select low. Then whether you answered it correct or wrong, it will show you explanation. This will help you understand better whether you answer correct or wrong, and while you're still learning with the questions and also the main explanation. And if you want to view for more, you can see the some of the infographic here. So very interactive, which help you to understand the topic better. And you can proceed to the next question. Due to time constraint, I won't be able to share every topics to you. I'm just gonna pick some of it and share with you. Okay. And if you want to learn about skills, I'll just pick fundamental of nursing. So I'll go to the skill video, and let's pick maybe on respiratory system and care for intubated client. Again, you will be able to view listen to the. So here you'll be able to see the definition, associated risk. So you want to know what the transcript, then you'll be able to see, it says that, reporting a case, then from there, how you go about it. Then you'll be able to learn about skills. And again, you scroll down, every topic, it comes with a necklace questions. Then you can start the questions. After viewing the video, learning about the topics, then you can click start. So it says drag and correct response into the right column in any order. So it says a nurse in the ICU caring for a client who has been intubated for 24 hours. What steps should the nurse take to prevent VAP in this client? Drag the potential steps to the right, choosing only the steps that are appropriate. I'll just no. Okay, I'll just simply choose, rate my confidence. Oh, I did it correct. Wow. And whether correct or wrong, it also gives me explanation. So I can still learn, from all these, interaction tools. And I can see the infographic, because maybe sometimes we are very vision learner. By looking at all this, animation image, I learn better. So that's all about, osmosis nursing. I hope that you can, make full use of this trial until 22nd March to prepare for your revision and as well as for your exam, if you have exams coming up. I'm gonna share my contact details. If you have questions or you have problem accessing to the ClinicalKey for nursing, my job is to ensure that you can access to ClinicalKey for nursing without any problem. If you have technical problem like downloading mobile app or accessing to some content, or sometimes if you log in, you don't get to view all content, please feel free to contact me. I'll be able to guide you, or WhatsApp me. I respond faster in WhatsApp. Okay, it's 11 o'clock. I just want to pause here to see if you have question. I'll just probably copy and paste my contact details here. Okay, Encik Shahril, I want over to you to share about how do they retrieve the video, right? You want to share, right?
Yes. Okay. Thank you, Ms. Carol, for the comprehensive explanation and training on the database. Okay, I would like to share my screen on how to access the trial. Oh, I think Ms. Carol has to give the link, right?
Yes, yes. I put in the link here already.
Okay. Okay. For the recording, you can access from my OUM. You can go here, announcement, and then go to others. You can see announcement here by the library, for example. This is for the osmosis just now. You also can access the link from here. Okay. For today's recording, by tomorrow, you can get the link as well from this site, from announcement and then others. Okay. Okay, I would like to invite Missy, our program director for Master Accounts, Master Nursing, to give some remarks. Silakan, Missy.
Okay, thank you, Cheshire. Thank you, Carol, for your endless support. I really speechless. And thank you, Cheshire, been doing this collaboration,
You're welcome.
coordinating, and always update me. And also Puan Anis. We also have Puan Anis here today, Miss Carol. She came in a little bit late.
No
So
problem.
for those students out there, I can't emphasize enough that you need the legitimate database in your assignment, even from very beginning, like first semester. Okay, so as I said, we have so many databases here. Please make full use of these. We are here to support all of you. There's a survivor guide there. You can just scroll down and you can have many other support. As for today's session, my message is try to use it and go into osmosis. You will love it because I love it so much. Thank you, Cheshire. Over to you.
Thank you, Missy. Okay. Do you have any question before we end the session? Ada soalan nak tanya by verbal ke? Student-student kita? Tak ada, eh? Okay, I think that's all for today, Missy, Miss Carol, Puan Anis. Thank you for participating in this session. Hope we can see again maybe next semesters or maybe for other database. Okay. Okay, thank you to all
Thank
of you.
Okay, bye.
Thank
Thank you
you.
very much. Have a nice
Bye.
day.
Thank you.
Bye.
Bye.
Thank you. Have a nice weekend.
Okay, bye.
Bye.